Is now starting. All attendees are in listen-only mode.
Hello, everyone. Welcome to today's webinar on foot care for peripheral neuropathy. We thank you all so much for joining us today for the session, and we look forward to discussing foot care today. My name is Lindsay Colbert. I will be serving as your moderator today. I am the Executive Director of the Foundation for Peripheral Neuropathy, and again, I thank you all for joining us today on what will be a very exciting and informative topic. Before we get started, I just wanted to share some logistical information with you. First, the presentation today is being recorded. The recording link will be emailed to you again, probably tomorrow, and you're welcome to view the recording at any time later. We will also be posting it on the Foundation for Peripheral Neuropathy's website. At any time during the presentation today, we encourage those who are participating with us live to submit questions through the questions box. Right now, you are all on mute, so if you do have a question, we encourage you to type it, and we will try our best to answer as many questions as we are able at the end of the session during the Q&A. Lastly, if you are having trouble with your audio at any time, or for example, right now cannot hear me, but you might not know that, we encourage you to use the phone number that was included in your email instructions to dial in. Sometimes it's a little bit more reliable than your computer audio. And now at this time, I'm pleased to introduce today's guest speaker, Dr. Jeffrey Lehrman. Dr. Lehrman is a podiatrist in private practice in Fort Collins, Colorado. He operates Lehrman Consulting. He is a diplomat of the American Board of Foot and Ankle Surgery, a fellow of the American Society of Podiatric Surgeons, and has been honored with the designation of Master by the American Professional Sound Care Association. Dr. Lehrman is also a certified professional coder, and in his role as a consultant of the APMA Health Policy and Practice Department, he serves as the staff liaison to the AMA CPT editorial panel, where CPT codes are created, deleted, and modified. He is also on the editorial advisory board of the journal Wounds and has taught both nationally and internationally on wound-related issues. We are honored to have him as our guest speaker today. And at this time, I'd like to pass the microphone over to Dr. Lehrman for his presentation. Welcome, Dr. Lehrman, and thank you again.
Thank you, Lindsay. Thank you for having me, and thank you to those of you who have joined us. I want to repeat something Lindsay said and expound upon it a bit, which is to invite you who are watching to please put questions in. Don't be bashful with the questions. There is no such thing as a silly question when it comes to this content. There are a lot of people on this, and it's pretty much a guarantee. If you have the question, others watching have the same question. So by putting your question, not only will you help yourself and get your own question answered, you're going to help a friend or another attendee who has the same question. And the goal here is to go for up to about 40 minutes after the hour with this formal content of me just talking, leaving a full 20 minutes at the end, maybe even a little more, for Q&A, because we want to be sure we get to all of your questions. With these virtual presentations, I think oftentimes the Q&A is the best part. At least it gives us an opportunity to interact to a degree. If you are watching this, you or someone close to you is affected by peripheral neuropathy. And our goal over the next 50 plus minutes here is to provide you with information related to peripheral neuropathy to help take care of your feet, and mostly to prevent problems, because with peripheral neuropathy comes the potential for foot problems. The good news is, even with neuropathy, the great majority, not all, but most, the great majority of those foot problems that can happen as a result of or related to neuropathy are preventable. So the goal here is to provide you with tools and information and ideas that you could take away from this and start doing or considering or talking to your doctor about to help you or your loved one who's affected by neuropathy to not have any of these bad things happen. We will talk about why this is important, right? We'll talk about what are these bad things that I am referring to and what you can do, what steps you can take to prevent them from happening, why they happen, what some of the names are, so it makes sense to you, and most importantly, what you can do to prevent those things from happening, or at least to help to prevent those things from happening. And at the end, we'll talk about a newer product, which is really cool, which is another step forward in the evolution of things that we can do to prevent foot problems related to neuropathy. This group deals with neuropathy, right? That's the name of the foundation. It was the title of our webinar here. And it's important to note that there are different types of neuropathy, 3 different types of neuropathy. And you as the viewer watching this, or again, the person you care about that might be experiencing this, may have one type. Some people have more than one of these. So it's good to identify the different types of neuropathy. Sensory neuropathy affects our sensory nerves. There are different types of nerves in the body and so neuropathy is just a fancy word for nerve disease. So that neuropathy can affect different nerve types. The most common type of neuropathy is sensory neuropathy. So that's where the nerve disease impacts the nerves that are responsible for sensing things, right? So those are the nerves that allow us to touch something and feel that it's cold or hot, or touch something and feel that it's rough or smooth. Or, now tying it more directly to what we're talking about today, have something touch the bottom of our foot, for example, and feel if it's sharp or dull, or if we can feel it at all, right? So those are sensory nerves. So sensory neuropathy impacts the nerves that allow us to feel things. Motor neuropathy deals with motor nerves. That's a whole different nerve type. So motor, you think of the word motor, deals with function. So now this is a different type of nerve that if we want to move something, right? If we want to close our fingers down, if you're looking at the video, there's a nerve that sends a signal from our brain all the way to our fingers that says, move your fingers, right? Making it much more simple for explanation purposes. But when we have the thought, I want to move my fingers, that thought has to get from our brain to our fingers, and that travels along a motor nerve. This is all happening, of course, at a speed that is hard to even comprehend when you start talking about milliseconds and how quickly these things happen, but that is a different nerve type. And yes, there is a motor neuropathy that can impact those nerves. So now reviewing, if we have sensory neuropathy, we might not be able to sense things properly, feel what we should be feeling. If we have motor neuropathy, that can actually impact our ability to function, to move body parts the way that we want to. The final neuropathy type is autonomic neuropathy. And autonomic is really just a fancy word for automatic. And this is a third nerve type. These are nerves that function automatically without us having to think about it. So if you think about, again, let's review because I think it helps to illustrate the different types. Sensory nerves allow us to feel things. Motor nerves allow us to move things. Automatic nerves function automatically. So before I give away the punchline, think about it. What's something that happens in our bodies automatically without us having to think about it? Well, a really easy one, I think, is our heart beating. And yes, the heart does require that information to be sent to it to tell it to beat, right? The muscles that are moving our fingers in the example that I gave, our heart is a muscle also. And that muscle tissue requires a signal coming into it, telling it to beat, a signal telling our lungs to take in air. Nerves are delivering those signals. Nerves to our stomach, saying if there's something in there, grind it up, right? I'm making it much more simple for explanation purposes, but I'm doing that with intent to help it make it very clear. Those are automatic nerves, and 3 different types of neuropathy that can affect each of those different types of nerves. So to review, sensory neuropathy, this is the most common one. And I suspect a lot of people who are engaged with this content are familiar with sensory neuropathy, where the nerves that sense and feel things are diseased to different degrees, right? The most advanced degree is where we feel nothing. And this happens most commonly at the nerves that are furthest away. We call the nerves that exit the spinal cord peripheral nerves. If you think of what the word periphery means, right? Far away from the center, or even just away from the center. But the further away we get, normally the smaller those nerves get. As those nerves travel down our, out of our neck, down the shoulder, down the arm, all the way out to the fingers, they get smaller and smaller and smaller. And the smaller they are, in most cases, the more likely they are to become diseased. So those that experience sensory neuropathy are most likely to experience that in hands and feet. And again, the most advanced stage is where we feel nothing, which can be really scary. To a lesser degree, some people still have some degree of sensation, but it's abnormal sensation. And some people report feeling burning when there's nothing causing burning, right? Tingling, pins and needles, shooting, throbbing, maybe over sensitivity. So we talked about not feeling anything at all. Some people with sensory neuropathy, the slightest little touch, they're feeling it more than they should. Another common thing is people say when it's their feet, they feel like they have a sock balled up, oftentimes right at the base of their toes, when there's nothing there, or the sock is not balled up there. So it's all about not feeling anything at all, or feeling things that you shouldn't be feeling. And this sensory neuropathy, when it affects the feet, can be bad for lots of reasons. When it's the things that we shouldn't be feeling, it's because it's really uncomfortable. For some people, it keeps them up at night. For some people, it wakes them up out of sleep. Very uncomfortable. For those that have the situation where it's completely numb and they feel nothing, well, now that's dangerous, especially when it comes to the bottom of our feet. Because for those people, if they get a cut or a scrape or an opening and they don't feel it, now they don't know that it's there. And they don't seek care for it, right? If you did feel it, you would say, oh, that hurt, I better look at it. Then you look at the bottom and see there's a cut, and you clean it or put a bandage on it, right? Or go to the doctor if it's really bad. If you don't feel it and don't even know that it's there, now you don't seek attention for it, or don't provide it with what it needs, like soap and water or a bandage. And you can see how this can turn into a really dangerous situation. So that's the sensory neuropathy. Motor neuropathy, we talked about where function is affected. And if you can't move your muscles the way that you want to, I think the effects of that are pretty obvious, right? Weakness. I use the hand example. When we talk about the feet, that can impact our ability to move, our ability to walk the way that we want to. It can result in coordination problems. And if we're not coordinating our steps appropriately, that can result in falling. And we know falls can be really dangerous. So risks associated with motor neuropathy, the inability to move things the way that we want to. And finally, autonomic neuropathy. Again, those are the automatic nerves that can have wide-ranging effect, where it can affect lots of different parts of our body. I won't read all of these because I think it's boring if the person talking reads the words that you're looking at But to point out some, particular to the feet, since this was to focus on our lower extremity and feet, sometimes with autonomic neuropathy, it can lead to anhydrosis, which is a fancy word for not sweating enough or not sweating the way we're supposed to, not releasing that fluid the way we are supposed to. And while too much sweating can be unpleasant or gross, no sweating at all can be bad because we're supposed to sweat, right? That's happening for a reason. So if the autonomic neuropathy leads to a lack of sweating, again, that fancy word is anhydrosis, that can cause problems. Hyperhidrosis is too much sweating, and that can cause problems also. And you see lots of other potential impacts of autonomic, again, the automatic neuropathy, not necessarily foot specific, but good to share anyway. And again, people can experience one of these types of neuropathy or two, or in some cases, when it's really bad, all three. Now, we promised content that would be specific to the foot. So why is this of concern to our feet? Well, one big one is that one that I talked about, where if we have numbness on the bottom of our feet and don't feel what we should, and don't sense what's going on the bottom of our feet. So I already gave one example where if somebody has numbness and they step on something and don't know it, they don't provide the care that they should, and it can turn into a problem, like an ulcer in the picture that we see here. Now, that's more of an acute circumstance, right? Where you step on something and you get an opening in your foot. However, those openings in the foot, like the ulcer that we're looking at here, those can develop slowly over time also. Now, this is more common in people with diabetes, but this is not only a diabetes thing. And I'm sure many of the people watching this share the pet peeve that many doctors have, including me, where people inappropriately tie neuropathy to diabetes as being that's the only way you can get it. But you guys know this, right? The people watching this know neuropathy is not only a diabetes thing. And the reason it's important with where I'm heading with this messaging is the bad stuff that can happen to the feet of people with diabetes, that can also happen and does to people without diabetes who have neuropathy, because they have many of the same risk factors as do patients with diabetes. And when we talk about this ulcer developing slowly over time as a chronic situation, what happens there in many cases is somebody has an area of prominence or a bone sticking out more than it should, or a bone sticking out where it's not supposed to on the bottom of their foot. This is common under like the big toe joint or under the baby toe joint. This is at the base of the toe on the bottom, where there's a bone sticking out more than it should, creating a prominence there and abnormal pressure there. So if somebody has that bone sticking out more than they should, and now every step they take, they're getting more pounding and pressure there, without neuropathy, the person would feel that, right? They say, oh, this something doesn't feel right. It hurts there. And they would go to the doctor or change their shoes or get some sort of insert in their shoe or do something, right, to get the pressure off that area. But the same sensory neuropathy that doesn't allow us to feel stepping on a staple also may not allow us to feel that situation where we're stepping on a bone more than we should. And if we don't sense it and don't do something about it and just keep walking on that area of bone sticking out, the skin can eventually break down under all of that pressure and open up, and that's what forms an ulcer. In many cases, people that have neuropathy may also have circulation disease, where the blood flow isn't as good as it should be. And now that creates a double whammy for the picture we're looking at here, where when that area does open up, now we may not have the blood flow to the area that we need to support healing that area. And that's one of the dangers of neuropathy. Another danger deals with that lack of sweating, right? We talked about the autonomic neuropathy and that the automatic nerves, and that one of the things can be a decrease in sweating or no sweating. And that can lead to a problem with the moisture content of our feet. The picture we're looking at here, many of you may say, oh, that's gross, which I get it. I think we can all agree it is. But this happens to people with neuropathy, where the moisture content is impacted, may be due to a decrease in swelling. And it can lead to this situation, which is very dry skin, which may not feel nice and may not look nice, but perhaps more importantly and more critical is now this skin is not supple, it's not healthy, and it is more likely to break open. So when this skin gets really dry like this, it can actually crack open. And when it opens up, even a very small opening, it can serve as an entry point for infection. Most of the time when people develop an infection, it's because bacteria had a way to get in, right? The doctors call it a portal of entry. You can think of it as now the window is open and there's an opportunity for infection to get in. So dry skin can be a serious condition in some people. So that's one of the reasons why that type of neuropathy can be dangerous. Now, I was careful to note that we all recognize that neuropathy does not only happen to people with diabetes, but we did want to at least spend one slide here specific to diabetes, and that is the fear of the diabetic foot ulcer. That picture that we showed, or that picture being an example of how a diabetic foot ulcer may present. And I told the story of numbness, and I can share with you all kinds of crazy stories of patients I've taken care of over the years where they stepped on something and didn't know it, had something stuck in their shoe and didn't know it for days in some cases. And the scariest example is the person that comes into the emergency department with an ulcer in the bottom of their foot, an opening in their skin. They didn't know it was there, and their whole foot and leg is swollen and red and infected. And you start to ask, did you hurt it? Did you do anything? Was there any injury? And the patient says, I don't know. I don't know what happened. My leg just blew up. Do you walk barefoot around the house? And they say, yes, I do it all the time. And then we take an x-ray and find all kinds of crazy things stuck in the bottom of their foot. A lot of times it's a staple or a piece of the staple. A lot of mail might have staple in the top right corner, right? Mail that you get out of the mailbox, two pieces of paper stapled together. In many cases, for those that have diabetes, it's an insulin needle that they drop on the floor and never find. Sewing needles and all kinds of other things that I have found on x-ray in the bottom of people's feet that they stepped on. They never felt it. They didn't know it was there. And because they didn't feel it when it happened, they did not seek attention for it. And now it sits there and gets infected. And people with diabetes are at high risk to develop these ulcers. And the scariest thing is that some of these infections actually lead to the need for amputation, which is terrible and scary. And all the more reason why we really want to embrace prevention. And I promised that we would talk about things that you can do to prevent all of these terrible things from happening. One suggestion, and I'm going to provide a bunch here, is to engage with a podiatrist. Because when it comes to taking care of your feet and preventing bad things from happening to your feet, a podiatrist can help, right? A podiatrist has an expertise regarding your foot, can provide the type of education that we're talking about here, and more education, and education that's more targeted to you, right? This is delivered to an audience of hundreds of people. The podiatrist should be able to evaluate you and your history and exactly what's going on with you, and provide targeted information and suggestions that can help you to prevent problems with your feet. Just some of these things include doing a circulation exam. So I mentioned one of the things that's important to know when talking about neuropathy is there also a circulation problem? The same way that you can, and I'm holding up my arm to the video, the same way you can feel a pulse here, right, in your wrist, or feel a pulse on the neck, there's a pulse in your foot that podiatrists can put their fingers on and feel, is that artery pumping? Is there circulation there? Podiatrists also do neuropathy evaluations by seeing if you can feel different things. And there are different types of neuropathy evaluations. And yes, different evaluations for sensory, motor, and autonomic. And if you didn't know those terms 26 minutes ago, now you do, I hope. Podiatrists can evaluate for those, for the presence of those, for the severity of those, and then take action, right? If the podiatrist determines that you have this type of neuropathy, what can we do about it? Or how bad is your neuropathy? What can we do about it? Of course, a skin exam, there are toenail things that may come into play. In some cases, patients with neuropathy should not be cutting their own toenails because it's not safe. And we see so many people that attempt to cut their own toenails and they can't see as well, or they can't reach as well. And as a result of that, make a mistake and cut themselves and cut their skin instead of the nail, or in addition to the nail. And then that cut can turn into an infection following the pathway that we just described. And in many cases, patients can go to the podiatrist and have the podiatrist cut their toenails for them. And in many cases, that is covered by medical insurance, where insurance picks that up in most cases. And the podiatrist can do that for people every couple of months, and you don't have to fight with your toenails anymore. And lots of other things that can result from engaging with your podiatrist. Aside from going to the doctor, there are things that you can do on your own. And talking to an audience of several hundred people, we have to be careful with the guidance we're about to provide. And of course, say different patients need different treatments. It's impossible to speak to an audience of hundreds of people and say, you should be doing this, this, and this, right? This is more intended to be a list of options of things that may be appropriate for you to help you in communicating with your own doctors or providers of other types, helping you in doing your own research, right? We can't say you should take medicine X because it's going to differ based on lots and lots and lots of things. These are more just intended to be ideas. And transitioning to that discussion of medication, there are some medications that may be appropriate for neuropathy. This absolutely is something to talk to your doctor about. These are appropriate for some people, not appropriate for others. Depends on your past medical history, what other medical problems you have, what else is going on, what type of neuropathy, how severe the neuropathy is, right? But it's a discussion to have with the doctor. Are there pills for what I have? And I would suggest also asking, what is their efficacy rate, right? Just because the pill exists for the problem is not a guarantee that it will work. And that's a good discussion to have, right? The doctor should be educated and have done their homework about this fixes your problem approximately X% of the time. And this is a good discussion to have for any prescription medication that's being considered, but especially for sensory neuropathy, because for some of these, their efficacy rate is not great, in the 50, 60, and 70 percentile. And it's a good discussion to have, right? Before you decide, do I want to take this? Or maybe even, do I want to pay for this? If that's a consideration, it's good to know what % chance do I have of this working? And that's going to vary based on you, what's going on, what the medicine is. And it's a good discussion to have with the doctor, right? I think most people are good about asking about potential side effects. And my experience is most patients know to ask that, or the doctor knows to provide that information right off the bat. But in addition to that, if you're not already having that discussion, what percentage of the time does this work? I think that's a good conversation to have. In some cases, what you eat or drink may play a role in neuropathy. Maybe you have a mild degree of neuropathy and you're listening to all of these things I painted, and ulcers and cuts that don't heal and dry skin, and you're thinking, well, I don't have that now, but I don't want to have that, right? We talked about what can I do to prevent that from happening. In many cases, nutrition is something to consider, and the doctor may talk to you about things you should be eating and drinking, and maybe things you should not be eating and drinking. And maybe it's not the doctor. Maybe doctor sends you to a nutritionist or a neuropathy class. And this is a good conversation to have, right? Do you have a list of foods for me that may be good to add to my list, or good things to avoid? And in some cases, this is just as good or better than taking a pill, right? Something that we can just control on our own. For some patients, exercise may play a role, and I'm repeating that I'm being very careful, not making any suggestions for individual patients. These are just things to consider which may be appropriate for you. Doctor may talk to you about the role that exercise plays in neuropathy, maybe even in improving your symptoms of neuropathy and or preventing it from getting worse. Tobacco use in most cases is a bad combination with neuropathy. In many cases, using tobacco can make your symptoms of neuropathy worse, or at least contribute to them not getting better. So normally, again, always talk to the doctor. Tobacco is typically a good thing to avoid when we're talking about neuropathy. I think we covered this one pretty clearly. This one I feel pretty comfortable saying to all members of the audience. Whereas for the others, I said it may differ based on who you are, but it's pretty safe to say if you are experiencing sensory neuropathy, it is best practice to never walk barefoot anywhere. Now, you're going to make an exception, of course, to get up in the middle of the night and go to the bathroom, or when bathing, but for the most part, to never walk barefoot anywhere. And I say that the way I do because I think earlier in my career, I wasn't as good at communicating that. And I had people come back and say, well, I was really careful around the pool, or as soon as I leave, I never leave the house without shoes on. Well, what about in the house, right? Remember my story about stepping on a staple, stepping on an insulin needle, stepping on a toy that a grandchild left on the floor or something, right? Actually, these things happen in the house more frequently than they happen out of the house. So the rule of don't walk barefoot applies to certainly outdoors, but in the house also. So if it's something you can pull off, maybe, so if shoes from outside are gross and dirty or wet or something and you don't want to bring them in, maybe a pair of house shoes or a pair of sneakers that doesn't go outside, that stay clean inside the house. Even a bedroom slipper that has some degree of a substantial sole to it, right? Look at this picture. If this person had a bedroom slipper on it with any degree of a sole on the bottom, right? Any thickness to the bottom of it, where's that thumbtack going to go? Where's that push pin going to go? It's going to go in the slipper and not in the bottom of their foot. And a disaster can be avoided that easily. Your shoes should, of course, be well-fitting, not too tight, not rubbing anywhere. We're going to get to that in a moment. Also, good practice to look at the bottoms of your feet every night. So sit on the edge of the bed and look at the bottoms of your feet every night. And what you're looking for is anything cut, open, bleeding, discolored, weird, really anything that shouldn't be there, right? And this goes back to the sensory neuropathy, that if you do step on that story I told about the lady in the emergency department who stepped on a staple. Well, she didn't feel it, so she didn't do anything about it. But if she had looked at her feet that night before she took her shower the next morning, she would have seen something, dry blood, an opening, something oozing out of it, right? But she didn't. She didn't look. She took a shower, the dry blood went away, and that's it. If you can't swing around real easily to look at the bottom, look at what this person's doing. They just put a mirror on the floor, or you could prop up a mirror against the wall. And then you can hold the bottom of your foot up to the mirror and look at the bottom of your foot that way. That's a good trick. We talked about the dry skin and the lack of sweating that people may experience. That's where moisturizing lotion comes into play. So for most people with neuropathy, the recommendation, for most people, again, check with your doctor, no individual recommendations being made here. For most people, the recommendation is to apply moisturizing lotion twice a day. Twice a day, that's a lot. Every morning and every night to the top and bottom of your feet, and not between your toes. Top and bottom, not between the toes. The reason is between the toes is normally kind of sweaty and moist on its own. And if we add more moisture between the toes, it can actually be too much moisture and lead to problems. So for most people, top and bottom, twice a day. That may differ based on you, what's going on with you. It can differ based on climate, right? And weather, or what area of the country you live in. So be careful with that, but for most people, that's something to consider. We talked about shoes, but it's not just shoes. We also want to think about socks and the inserts that go in those shoes. So get this question a lot. Not sure where this comes from. Doctor, should I be wearing white socks? The color of your sock has no impact on anything. It doesn't matter what color it is. So I'm not sure where this comes from, but any recommendations that a doctor or anybody makes for a patient when it comes to medical care should be based on medical literature. And there is nothing published in any doctor journals anywhere that says the color of the sock matters. Doesn't matter what color it is. It does matter if it is comfortable and you can get it off and on without it being too tight. And in some cases, if there's swelling, doctor may tell you that you would benefit from compression in your sock to aid with swelling. Your shoes should fit well. A good trick in shoe shopping is our feet swell during the day. So it's a good idea to go shoe shopping at the end of the day. That way you don't risk getting a shoe that's too small and then swelling into the shoe a couple days later. So that's a good trick. Go shoe shopping at the end of the day. Many people, their foot length is different. So don't make the mistake of measuring one and then getting two shoes of that size. Many people, you'd be surprised how many, I think, require a different size shoe for left and right. If you have difficulty with dexterity issues, or remember the motor neuropathy, if you have difficult tying laces, Velcro may be something to consider. And of course, you want something where there's no rubbing, and the insert of your shoe is something to consider as well, where it is an appropriate height for your arch, it's comfortable and soft with nothing rubbing. And before we conclude here, as we talk about inserts, that provides for a nice transition for the new option that I teased at the beginning of our time together here. There are now smart inserts, which are really cool. So we have smart phones and we have smart TVs. There are now smart shoe inserts that can monitor temperature and pressure of our feet and then communicate those readings to our doctor, and the doctor can monitor that feedback and see what's going on with our feet. So you see the picture there, the insert just slips in the shoe, and the insert again monitors temperature and pressure, And we talked about the fact that people with neuropathy may not be able to detect abnormal pressure or temperature. Well, for people with neuropathy, the smart insert that we're talking about here does it for us. And if there is an area of increased temperature and or increased pressure, the smart insole detects that and sends a message to our phone. So we get an alert, right? You, the patient, gets an alert that says something along the lines of, I'm paraphrasing, you have too much pressure here. And you can see the cool video there. It tells you exactly where you should, and then it even makes suggestions, right, about what you can do to protect that area. But in addition to that, it also sends a message to the doctor. And the doctor can monitor this feedback. The doctor gets alerted when you have something going on, and the doctor can intervene and help you with what's going on. From the doctor perspective, the doctor can get paid for this. So if you're thinking, is my doctor really going to sit there and look at the feedback from my shoe insert? Every time the doctor does something, the doctor can submit a code, and that's how doctor gets paid, right? So doctor takes out a gallbladder, they tell the insurance company with a code, I took out a gallbladder, they get paid for taking out a gallbladder, right? Doctor sees you for a foot exam. There's a code for the foot exam. Doctor gets paid for the foot exam. There's a code for monitoring your feedback. Doctors like this because they like providing the good care for
Hi, everyone. Sorry about that. It seems like Dr. Lehrman might have accidentally lost a little bit of internet connection, which is unfortunately common in remote sessions like this. If you all can bear with us, I'm hopeful that he'll be able to rejoin us in the next coming minutes. Sorry again. We do have quite a few questions that have come in. So in the meantime, when you're waiting, if you have not already submitted a question, I encourage you to please submit a question. We'll try our best to answer them during this session. Hopefully, again, Dr. Lehrman will be able to rejoin with us, and if for any reason he is not, we will be sure to make note of all of the questions, and we will try our best to follow up with all of you in either an email or some type of website post so that we can still manage the question and answer session even if we're not able to do it live. The only good news to this is that Dr. Lehrman was almost done closing his presentation. We were just going to go into the question and answer section, and unfortunately, again, it seems like we accidentally lost him.
Am I back?
Dr. Lehrman, yes, I can hear you. Can you hear us?
I'm so sorry. Was that just me or everybody?
I think it was just you. I'm hopeful. I still see that there are quite a few people that are still with us live. So
all right.
I just popped on,
So
but I'm glad you're back,
just,
Dr. Lehrman. Why don't you jump in? I'll let you finish, and when you're almost done, we can continue with the Q&A section. Sorry about that, everyone.
I was just transitioning to the Q&A, and I promised 40 minutes, so let's wrap up. The bottom line with these smart insoles, as they are called, the Orpix SI Sensory Insole, and this is something you can talk to your doctor about, and I would suggest, if this sounds as cool to you as it does to me, to jot down Orpix SI Sensory Insoles. Lindsay, I can't advance the slide, but if you advance it 2 more, please, the people will have the information. Sure. And you can just tell your doctor, I heard about this really cool thing. It's called the Orpix SI Sensory Insole, and I'd like to get this going with you. And thanks for your attention. Apologies, we lost 2 minutes of our Q&A, but let's get to it.
That's okay. We can talk really fast. So Dr. Lehrman, we thank you again for your presentation. This has been all too informative. We also, on behalf of the Foundation for Peripheral Neuropathy, thank Orpix for sponsoring this and for helping us find you. I think one of the questions that I have and a couple of other patients have asked during this live session is, you know, a podiatrist, a neurologist, in your opinion, who should a patient with peripheral neuropathy who has foot problems go see? Is it one? Is it two? Is it both? What do you think about that?
Well, probably both, but it depends on what's going on, right? So, and this will differ based on the doctor, and it may even differ based on geography. Most of the time, the podiatrist can help with the effects of neuropathy, right? What the neuropathy causes, so the dry skin or the wound that's not healing, or preventing that wound. Whereas the neurologist will likely address the neuropathy, right? And maybe treat the neuropathy. So to sum that up, most of the time, the neurologist can help fix the actual neuropathy, whereas the podiatrist is going to be focused on the foot effects of the neuropathy most of the time.
Yeah, and I think from our perspective, a combination is always best. It doesn't hurt to see a couple of different people. You're going to get different answers, and it's really important to take foot health seriously. So I think a podiatrist is a great option for many who are willing and interested in seeing one, in addition to, you know, their primary care physicians. So how does someone find a podiatrist that is, I guess, knowledgeable in peripheral neuropathy? Is it a safe assumption that all podiatrists know neuropathy patients and the foot problems like you do? Or should that be not a good assumption? And then how does a patient go about finding someone like you that really can help someone who has neuropathy?
Well, I think most do, but it's always good to ask, right? So the same way you would doctor shop for anything else, right? If you're online or Yellow Pages or asking friends, whatever you're doing, it is totally fair when you call that office to ask, can the doctor help me with neuropathy stuff in my feet? And you'd like to think you'll get an honest and straightforward answer. Most of the time, I think you'll find the podiatrist can, but there are some that are very specialized, right? And you might get a surprise. And the person on the phone says, no, our doctor really focuses on this. You should go somewhere else for that. So I would suggest just asking, right? Does Dr. Smith can help me with neuropathy things in my feet?
Perfect. I mean, it sounds simple. And to your point, I think sometimes patients just forget to ask those questions before they go into the appointment. But I think it's an appropriate kind of, you know, prerequisite, so to speak. So let's talk a little bit about shoes. You know, how do you recommend a patient that has neuropathy finding comfortable shoes that they can walk in? I mean, you have the cushy shoes that don't give enough support. You have supportive shoes that sometimes might hurt. Without getting into specific brand names, do you have any thoughts on what people can do to find a shoe that fits them?
Yeah, and it's funny you said the thing about brand name, because the first thing I was going to say is be careful with anybody saying, oh, you should wear brand X, right? Fill in the blank. Because there's no such thing. And I'll say again, recommendations from doctors should be based on what's in our medical literature, right? Doctors have magazines they're supposed to read that, you know, it's continuing education. And there is nothing written anywhere in any medical literature that says people with neuropathy should wear this type of sneaker. It's one of the reasons why there's a million of them at the store, right? Because different shoes work for different people. And it's going to sound silly, but the best recommendation is to wear what's comfortable. Now, you might say, well, I have neuropathy. I can't feel it. I don't know what's comfortable. And that's where you might need help, right? That's where it may be a good idea to engage with a shoe specialist or a podiatrist or somebody that can help. And in general speaking terms, I would suggest following the guidelines that we already provided. Go late in the day, measure both feet, consider laces versus Velcro, nothing sharp, nothing rubbing, be careful of seams that might rub and cause a problem. And It's going to sound like a stereotype, but well-fitting, not too tight and not too loose, which I don't know, feels like a doctor thing that if I were listening, I might say, well, that's very nice, but how do I do that? There's really no other way than to just go try them on and find the one that feels good, that's not too tight and not too loose.
And you bring up a valid point in general, because as you know, and we here at the Foundation for Peripheral Neuropathy knows, every patient is different. There's no one single treatment currently that works for anyone, because currently there is no cures for peripheral neuropathy. So what we're trying to do is find what's best for you, the individual. So I think a lot of these kind of questions and resources are really helpful. And, unfortunately, it might take some time to find that answer for each person, but it is all too important, especially when you're dealing with, foot problems from your neuropathy. I like massages. What do you think about foot massages when it comes to foot health in general? We have had a few patients ask us about that, and personally, I would like to know that too.
Well, again, I have to be careful to say, check with your doctor. The answer might be different for different people. I have lots of patients that I would say, yeah, go for it. It's great. And I have other patients that I would say, that might not be a good idea for you, right? And those are the people that are at greater risk. Maybe their neuropathy is worse, or they have circulation disease in addition. So let's be careful with that. And most thorough thing is to preface it with, check with your doctor. With that being said,
yeah,
for the most part, if you like it and it feels good and you enjoy it, do it, right? For most people, there is no therapeutic benefit, right? There's no study that has been said, if you get a foot massage, it's going to help with this, this, and this. Same the other way, right? Very little concern for anything bad happening. So for the most part, it's fine. If it feels good, go for it. For most people, right? People that have really bad circulation problems, I might be concerned about the massage person squeezing too hard, right? Or pushing too hard in a certain spot. But most of them are really good when you get there. They ask about any pain points, anything I should be aware of, anything we need to be careful about. So for the most part, it's safe and fine, but always good to check with your doctor first.
Always a good closure on that. And kind of similar to that with devices, if you're familiar with massage devices, or even, TENS machines, what are your thoughts on that when it comes to foot problems?
So with neuropathy, right, we want to avoid anything sharp or rubbing or rough or anything like that. And the other trick with some of the things that were mentioned is heat, right? So we talked about sensory neuropathy, not feeling things the way we should. And one of the things we might not feel is temperature. And there are people with neuropathy that burn themselves, a real burn, with a normal everyday household thing because they couldn't sense that it was too hot. In some cases, bath water, where you fill up the bathtub, you can't feel how hot it is, and the person plunks their foot in there, and next thing you know, it's red like a lobster, and they have a burn. So similar precautions with those items that you listed as we have for other things. We don't want anything too hot, sharp, rubbing, anything that can do any damage. And if it's not causing heat, or if you have someone in the house who does not have neuropathy, feel it for you, right? Or use a body part that doesn't have neuropathy. Maybe the neuropathy in your hands or feet are bad, but you say, man, I sure can feel it if my elbow rubs on something. You can even dip your elbow in that water, or put the TENS sticky adhesive patch on the elbow and see if anything feels weird there. Got
it. So what should people be doing to, if anything special, to maintain neural health? In other words, is there more than just masking the tingling that's necessary to ensure foot and toe function doesn't get lost? And we're really more concerned about loss and degradation here, right?
Right.
What are your thoughts on that?
So again, it's going to differ based on the patient, but it's a lot of the stuff that we talked about, right? So in some cases, medication may play a role. For some people, for lots of people, nutrition can help with that.
Great.
Activity, avoiding tobacco. I'm repeating a lot of what we already said. Don't walk barefoot, properly
Sure.
fitting shoes. And I would suggest the newer product that we're looking at here, the Orpix SI sensory insole, which goes a really long way to picking up problems before it's too late and identifying the area that's at risk to develop a problem and communicate that to both you and your doctor before it's too late.
Great. And kind of going back to this insole in general, I mean, some patients are wearing double socks, right? Two pairs, just to kind of prevent rubbing. What are your thoughts on that? Is that helpful? Is that scientific? Is that anything?
Yeah, well, you asked the right question. Is it scientific? So the first thing is, no, there is nothing in the medical literature that says double socking does anything. However, there's also nothing that says it's bad. And if you like it and it feels good and it keeps your feet warm in the winter or anything like that, go for it. Just make sure there's no seam that's rubbing. And maybe, you know, like the first layer, if it has a seam that would be okay on its own, but the second sock smushes that seam into the skin, that could be bad. If they're really thick socks and it impacts the way you fit in your shoe, that could be bad. But for the most part, it's fine while there's nothing that says it's going to help anything.
Sure.
Yeah, as long as it's not doing any damage.
Sure. And that kind of leads me to another really great question. And I know we're running short on time here, but talking about damage. So someone has idiopathic peripheral neuropathy or diabetic peripheral neuropathy, whatever form of neuropathy, they're running, they're playing basketball, they're exercising, they're feeling great, but is that okay? Is that safe? Should they be checking their feet every day because they have neuropathy and they're at increased risk? Ultimately, will this increased activity, maybe high intensive activity, potentially induce some foot mechanical issues just because they're a neuropathy patient?
So again, you guys are going to get sick of me saying this, but it's important. It differs based on the patient. But for the most part, that activity is so helpful and super important, not just for nerve health, but for all of your body, right?
Sure.
And we need to be healthy everywhere. And that activity is an important component of that. Now, if you have a degree of neuropathy, yeah, your risk of injury is somewhat greater. You look at a professional athlete who does not have neuropathy, they have risk too, right? LeBron James could sprain his ankle. He just did a couple weeks ago, right? So anybody's at risk for bad stuff to happen, and different people need to take different precautions. Your neuropathy may impact the need to wear an ankle brace if you're playing basketball, or a different type of shoe, and that differs based on the patient. But for the most part, don't let that dissuade you from being active. And I would like to think that the last thing the doctor would resort to is, well, you have neuropathy, you shouldn't be doing that. But rather, you have neuropathy, what can we do to help you to do that thing safely?
Right. And at the end of the day, listen to your body, right? I mean, if your feet hurt when you're running and it's more of just a normal pain or discomfort, hopefully you have that sensation still, or similarly check after you do, just in case. It wouldn't hurt just to see if you have any ulcers, blisters, you name it, kind of developing in the insoles. I think that's always also a safe recommendation as well. But again, Dr. Lehrman, thank you so much for this. I as I mentioned briefly when you were offline, we had so many questions come in. We will try our best to answer some more, and maybe we can work with you closely to do that in the coming weeks. But for everyone watching and that stayed with us, we really appreciate it. We hope that this was an educational and informative session. We hope you like the webinar. There's going to be a survey that's going to be sent out shortly after we close in a couple of minutes. So please take it seriously, provide feedback, both positive and not, so that we can continue to provide these types of educational recordings and learning sessions in the future. We also hope that you will continue to support us here at the Foundation for Peripheral Neuropathy financially, so we can continue to provide this type of support. Again, another special shout out to our sponsor for today's webinar, Orpix. So again, thank you for that. And as always, if anyone has any questions, foot related or not, with respect to peripheral neuropathy, we are here for you. Feel free to call or email. And with that, I'd like to close today's session. A recording of this session will be sent to all viewers and will also be posted up on our website within the next day or so, and along with the slides. And if you need anything else, just let us know. Again, Dr. Lehrman, thank you so much.